Hi, I'm Tessa, a veteran educator working in the field of special education.
And I'm Kim, mom of two autistic boys and a late diagnosed autistic person myself.
And welcome to Totally Over the Spectrum, where we dive into embracing autism through understanding and support. Welcome to episode 23. In our previous episode, we discussed issues relating to anxiety. So we're going to break it down a little bit further between the difference between autistic anxiety and generalized anxiety disorders. So, and I know you have your list, so let's go.
All right. So, according to the Diagnostic and Statistical Manual, anxiety disorders,
which is the DSM-5,
differ from developmentally normative fear or anxiety by being excessive or persisting beyond developmentally appropriate periods, right? Okay. So anxiety is a mental condition, right? And characterized by excessive apprehensiveness about real or perceived threats,
okay,
right? And that leads to avoidance behaviors and often physical symptoms such as increased heart rate and muscle tension. Okay. Now, everybody has anxiety sometimes, but we're really looking at autistic anxiety and the overlap with what, anxiety disorders and why you might think they're the same and they're not.
Yep. Okay.
Anxiety disorders would be determined by a qualified clinician, right? Your psychiatrist or psychologist. So how do you differentiate between the two? Having anxiety does not necessarily mean you have an anxiety disorder. Having autistic anxiety doesn't necessarily mean you do not have an anxiety disorder. So what I really wanted to talk about was why, how those two things overlap, and even though the symptoms are the same, the causes might be different.
Yes. Because a lot of the times I find that people misunderstand a person's autistic trait is who they are and how they present, and can miscue that as being anxiety.
I suppose that can happen too. Yeah, I think there's a lot of anxiety in the autistic community, but the reason for that anxiety is different than an anxiety disorder sometimes.
Mm-hmm.
So the first one I have is generalized anxiety disorder,
which a lot of people with autism fall under. Right? It's one of the biggest components. There are other disorders which are less likely to occur, but I'm going to let you give us all of the info so that
the definitions. So generalized anxiety disorder is characterized by excessive, uncontrollable worry about various aspects of life, such as work, health, social situations, and it has to persist for at least 6 months. For a clinical definition. So you can see where there could be a lot of overlap in this one. Because autistic individuals often experience heightened anxiety due to their struggles with managing uncertainty, disruption to routine, like we talked about this in our previous episode, and I'll put a link to that. And that can manifest similarly to generalized anxiety disorder, but doesn't mean you have generalized anxiety disorder.
No, it's just that people with autism have not developed the resiliency skills or the coping mechanisms or have effective strategies in place in order to deal and understand, that type of aspect of their lives.
For autistic people, the anxiety could be more rooted in difficulties with change and predictability rather than pervasive, uncontrollable worry across those life domains, right? So the reason for it might be a little bit different. The second one I have is social anxiety disorder, which is sometimes called social phobia.
Yeah, that was for all of the research that I did, and I'm going to be referring primarily to the Australian society over here. It is the number one aspect in where there is the most overlapping, as they find. So I'm going to focus more so on what the signs and symptoms are on those two, and because it comes up in all of my research as the number one.
So, a social anxiety is defined as a marked fear of social situations where a person feels they might be judged, embarrassed, or humiliated. Social anxiety is common for autistic individuals, yeah. Both involve a fear of social interactions, but for autistic individuals, the fear may stem from not being able to communicate effectively or from being misunderstood rather than an intense fear of judgment. That could also be a possibility.
Yes.
We did talk in our last episode about rejection sensitive dysphoria, which, again, if someone would like to hear us talk about that, we leave us a comment and we'll do that as a podcast.
Yeah. And part of the research that I did is that they have the difficulties in understanding social cues, norms, expressing themselves, the ability to express themselves and their feelings and their emotions, kind of leaves them feeling that they're isolated, which then increases that level of anxiety, right? And can then overlap into a little bit of depression. So, this was the number one area in which most overlaps occur and are very common in both areas.
Personally, I read this and thought, how does any autistic person not feel judged in the world? Like, how does that even happen? And I talked to my son Alex about it, who's level 1 and low support needs. And he's like, Mom, no one cares what I'm doing. They're all wrapped up in their own lives. Like, he has no anxiety whatsoever. And I'm quite happy he didn't get my anxiety. But anytime I talk to him about these things, he's like, Mom, no one cares. Like, don't be worried about it. It doesn't matter. Like, he
is the most
easygoing.
Yes, he is the total opposite. He is the poster child for somebody who does not experience or, really has any care about or any anxiety whatsoever. Yeah.
I'm really grateful for that.
Yep.
So not all autistic people have anxiety or have social anxiety. So
but data shows and
a lot.
statistic shows that it's now between 50 and 60%. So it's definitely increased about 10%.
The next anxiety disorder I have is panic disorder. So that is characterized by recurrent and unexpected panic attacks. So those are intense episodes of fear and discomfort that peak within minutes. Panic attacks in autistic individuals might be triggered by overwhelming sensory input, unexpected changes or difficulties in adapting to new situations, which can mirror the symptoms of a panic disorder. But the trigger for an autistic individual is often more external rather than internal.
Yes, I agree with you on that. It is mostly, I find, 9 times out of 10, it's sensory motivated. So, and once you remove that, they usually calm very, very quickly. Where if it was a traditional panic attack or a diagnosed clinical panic attack, it takes a lot longer and it takes a lot of steps to be put into place in order for that person to then come down from a panic attack.
Yeah, I'm not saying that for all of these. It's not that autistic people can't have any of these disorders. It's just sometimes things look the same, but they're for different reasons. Number 4, I have a specific phobia. So an intense irrational fear of a specific object or situation, such as flying, heights, or spiders.
Yes.
In autistic individuals, phobias may be linked to sensory sensitivities or past negative experiences, whereas in typical phobias, the fear is often disproportionate to the perceived threat.
Yes.
So, for an example, my son Peter, who's level 3, high support needs, non-speaking, he's terrified of animals, which developed over time. It could be from a specific incident. I'm not sure. But that is different than something like, I told you this one before. I'm sorry. I love unusual words. So there is a fear of long words. That is a phobia that exists in the world. And I find it fascinating. And I'm not minimizing that someone has this phobia and that is debilitating for them. And if you have that trigger warning, I'm going to say a big word because I love it. It brings me joy. Long words, just unusual words bring me joy. The scientific name for a fear of long words originally was Sorry. Sesquipedalophobia, right? So, and then somewhere along the line, it got elongated.
Yep.
And it became hippopotamonstrosis And I think that is...
It's such a contradiction, isn't it?
It's really
but
ironic.
a hilarious
and
one.
It's kind of mean. I'm not going to lie.
And
That's kind of mean, but it's also kind of funny to me. Because why would you do that to someone? Really, like it's unkind. But the word brings me joy, so I'm torn on that. Yeah. So that's specific phobias. It can look like the same thing, but really the reason for it is different.
Okay. And it's not something that's common within the autistic community, I find. That's not usually one that I would say, oh yeah, I would say and having worked in this field for about 15 years, I haven't come across that one when working with people with autism.
Yeah, it's not like an autistic child has a fear of slime. It's just they don't like the texture, and they're going to have a very big adverse reaction to touching it.
Yes.
Number 5 is agoraphobia. So that is a fear of being in situations like being outside or in crowded places where escape might be difficult or help unavailable. The experience of sensory overload or unfamiliar spaces is pretty common for autistic individuals, and it can sometimes resemble agoraphobia. So autistic individuals can avoid those kinds of spaces, but they're trying to prevent sensory overwhelm or social discomfort. It's not a fear of escape.
No, it isn't. So, and it is, once again, it's rooting back to that sensory aspect of them. So when we'll continue.
Okay. Number 6, I have separation anxiety disorder. So that's when there's excessive fear or anxiety about separating from attachment figures, which are usually your parents or your caregivers, that go beyond what is typical for a person's age. So autistic children may experience distress when separated from their caregivers, but the anxiety might be linked to the changes in routine or fear of the new and the unpredictable, rather than a primary attachment issue.
Yeah.
Right?
I agree on that one.
So, I mean, Alex cried when I dropped him off in kindergarten for the first little while, like lots of kids do, but he was not upset for me to leave him if he was at home. It was the school environment, right? It wasn't a separation from me.
It was an introduction of a new environment, a change in routine.
Yeah. And then I have Peter, who was never sad or upset about going somewhere new or experiencing new things. And he was like, bye, Mom. See you later.
Yep.
What kind of mischief can I create in this new landscape? That's, Number 7, selective mutism. It's interesting. So this is a rare anxiety disorder, typically seen in children, where a person who is normally capable of speech does not speak in certain social situations, often due to anxiety. So autistic individuals not speaking could be due to a delay in language processing or an overwhelming sensory environment rather than a refusal to speak due to fear or over a desire to control the environment.
Yeah. It's also one of those disorders that you don't often see within the autistic community, right? So I think we're going into very specific fears and that don't usually relate to, but can sometimes be misunderstood by a person with a level, I would say level 2 to 3 autism.
Yeah. I mean, even for myself, sometimes I don't speak in a certain situation because I've had bad experiences in the past or because I don't think what I have to say is going to be well received. Right? So I will get quiet.
Okay. So that's more tied to your social interaction of it versus the actual phobia.
Yeah. But sometimes I also need more time to process.
Mm-hmm.
Right? And the average person wants you to respond to them in 2 seconds. And sometimes I need longer than that.
Yeah.
You get overloaded with sensory input and you can't. You just can't.
Yeah. So.
Number 8.
Okay.
Post-traumatic stress disorder.
Okay.
So that is a trauma and stress-related disorder triggered by exposure to a traumatic event, such as abuse, an accident, or combat. Autistic individuals may develop PTSD-like symptoms, particularly when they've experienced bullying, rejection, overwhelming sensory experiences that were traumatic. But the trauma in autism might not always be linked to a specific identifiable event, and more like a pattern of social exclusion or sensory overload.
Yeah.
So I don't know if you've heard of complex PTSD.
I have heard of it, but I would like you to provide a clinical definition of it, because I think that would be something that would overlap more specifically.
So that is a mental health condition that can develop after experiencing long-term or repeated trauma. It is not recognized in the Diagnostic and Statistical Manual as separate from PTSD. It's not recognized. But I think that this is where autistic people are really going to identify.
Yes.
Right? Because you have really, I sometimes have intrusive memories, right? Of really painful or embarrassing social interactions from when I was a kid out of nowhere. And I will feel all of those feelings all over again, right? So, okay. When I was 12, right, I was not versed in having periods, right? You're 12, you're new to whatever. And I can remember vividly being at recess and thinking, oh, I think something might be happening. And I wanted to check, but they wouldn't let you inside at recess. Once you were out, you were out. That was it. You're not going back inside. So I thought that I could check very discreetly and no one would know. But I was not as discreet in that moment as maybe I could have been or I thought I was. And I got called out for it because kids are mean, right? And that is 40 years ago. And I can relive that moment whenever I want to, like if I stop and think about it. But I don't relive it every day, right? Just periodically it might pop up. But when you have a lot of those moments over your lifetime, right? It builds up.
Yes, it does. Yeah.
I mean, it doesn't keep me up at night, but I still remember it.
Yeah. And it hurts.
Yeah.
Yeah, it still does.
Number 9, I have acute stress disorder. So that's sort of similar to post-traumatic stress disorder, but the symptoms occur immediately after a traumatic event and only last for a few days to 1 month.
Okay.
So autism is lifelong,
Yes.
right? And while you can put accommodations in place to help you navigate the world, we talk about accommodations in episode 15. I'll put a link. There are always going to be new stressors as you go through life. So I found this one particularly difficult to distinguish because how traumatic an event is really depends on the person and their particular sensitivities.
Yeah. And their resiliency and depending upon whether it's social, whether it's sensory. So yeah, I agree with you. It's not one that ticks the boxes with me.
Yeah, I couldn't really do that one very well. But, I'm a completionist, so I added it to the list. I've only got 3 more. Bear with me. Obsessive compulsive disorder.
Well, that I think is consistent. So that was part of my top 3, where the overlapping is. So yes, definitely compulsive disorder is in my top 3.
Okay, so this is an anxiety disorder where people experience intrusive, unwanted thoughts, which are obsessions, and feel compelled to perform specific rituals or behaviors, compulsions, to reduce the anxiety caused by those thoughts.
Okay. I think it is not so much as the thoughts as it is routine for a person with autism, right? So the routine, the structure can be now translated as to being obsessive, right? So, I can give you examples of students that would have to repeatedly do something because of a sensory need and a routine of doing it versus, obsessive compulsive.
Yeah, stimming is not an obsessive compulsive behavior. It's a form of self-regulation. So yeah, those repetitive behaviors in autistic individuals can look like that to somebody else because that's what they know and they can associate it with. But the motivations are different behind those things, right? In OCD, you're doing that to relieve those intrusive, obsessive thoughts,
Yeah.
not to self-regulate. So I don't drive the same way every day because I'm afraid of what might happen if I don't drive that way, right? I find comfort in the routine, and I like being efficient. So I've found the most efficient way to drive from A to B, and I can accurately predict how long that's going to take, even if there's traffic or not. I can deviate from that. Does that cause distress? Yes, that causes distress. I like my routine. But it's not like I fear something bad is going to happen.
Yeah. And you're not demobilized as a result of that.
No. Dysregulated, maybe.
Dysregulated, yeah.
But
But you will still carry on the task. You will complete the task. You will be exhausted from that task of being, diverted to doing it an alternative way. But you will then recover from it in a short period of time and reset.
yeah.
Okay.
Number 11, anxiety due to a medical condition. So anxiety that arises from a medical condition such as a chronic illness, hormonal imbalance, or neurological disorder. Autistic individuals with medical conditions might experience anxiety-like symptoms due to physical discomfort, medication side effects, or changes in routine related to their health care. That overlap can make diagnosis challenging.
Yes, that's a tricky one for me as well. That doesn't quite, tick the box, but it's, I would
think
never
it would
dismiss it.
Yeah, it would be difficult for a medical professional to be able to sift through that.
Yeah.
And the last one I have is substance or medication-induced anxiety disorder. So that is anxiety symptoms that are triggered by the use or withdrawal of drugs, medications, or alcohol. Certain medications can trigger anxiety symptoms, and differentiating between anxiety due to medication side effects or an autistic anxiety is going to require some careful evaluation.
Yeah, and this is your, going to your psychologist or psychotherapist and really working and having a clear understanding of what these medications are and what they do. So it does happen. I would say it does happen in when there are people on, psychosis medication. It does provide them the situation in where anxiety is part of the symptoms. Would I say maybe 3 to 5%, I would say. And that's the best educated guess I can come up with. And from experience in working in the field.
Yeah, I mean, if you are taking a new medication and anxiety can be a potential side effect from that, like you really have to pay attention to, were you anxious before taking the medication, or is this medication causing you to be anxious?
Yeah. So there are a lot of subtleties that overlap, but to me, when I was researching this, the common denominator was social, where there was a very, a largest amount of overlapping. Sensory was the next big one, right? Which as a result of responding to those sensory overloads or not having enough sensory would then translate into what appears to be anxiety. But your social aspect of it was the biggest.
Yeah, if any of our listeners feel like they have any of those anxiety disorders that were talked about, please contact a qualified healthcare professional like your family doctor who can point you to a specialist.
Yeah. And if there's any, stories or experiences that you would like to share with our listeners, so that they feel that, they're not navigating this path by themselves, please, comment and share, and we would love to hear from you.
Yeah, I really enjoy the comments.
So, and until our next episode.
Yeah.
Which will be number 24. 4. I can't believe it.
I know, getting up there. So that is, when do you open up about your child being autistic? And I think we're going to do a series of these.
I think so, because I think it just can't be, we have to address the different age groups,
Yeah.
right? And I think we're going to break it up into several different episodes in order to cover the full aspect of it. And the reason we kind of broke this down to 30 minutes is, feedback from our listeners. And we'd like to give a shout out to Amy. Thank you for the suggestion. And I hope this is working well for everybody.
Yeah. And thanks for listening, Amy.
Have a great day.
We'll see you then. Thanks for tuning in. If you know someone who might find this episode helpful, feel free to share. Also, check out our website and socials linked in the description.